Welcome to the Mudra therapy series. In this video, we are gonna see 3 mudras that aid in controlling thyroid. First, Shunya Mudra. The middle finger, which stands for the element of space, makes contact with the thumb, representing the fire element. During the Shunya Mudra, it aids in the treatment of dosha imbalance and alleviates thyroid-related disorders. Shunya Mudra is particularly helpful in cases of hypothyroidism. How to perform this mudra? The middle finger should be softly pressed with the thumb. Too much pressure would obstruct the flow of energy. Second, Surya Mudra or Agni Mudra. Performing the Surya Mudra boosts the metabolic activity of the thyroid gland. Thus, by lowering the levels of bad cholesterol, this mudra lowers the risk of heart blockage. How to perform Surya Mudra? Sit in the Padmasana position. Ensure that you are sitting on a mat and not the floor. Put your hand on your knees or thighs and allow them to relax. Bend both of your ring fingers, putting the tips at the base of your thumb. Ensure that the thumb is pressing the ring fingers' tips. Keep the other fingers outwardly stretched. Make sure to use your thumb to moderately press down on your ring finger. Third, Shank Mudra. Shank Mudra is very helpful for thyroid disorder patients since it involves reciting the meditative sound of Om. Vibration is produced by the vocal cords when Om is chanted in this mudra. The thyroid gland, which secretes the hormone thyroxine, is stimulated by this vibration. In this method, consistent Shank Mudra practice relieves hypothyroidism. How to perform this mudra? Encircle the left thumb with the 4 fingers of the right hand. Keep your left hand's 4 fingers straight and pointed up. Slightly roll the thumb that is enclosed. Join the tip of the right thumb and the middle finger of the left hand once the left hand's fingers are all pointing up. Your hands now resemble a conch shell. Bring your hands to exactly where the breastbone is and hold your fingers in this position. Chant Om in your mind while keeping your eyes closed and concentrating on deep breathing. Although thyroid conditions cannot be cured, they can be managed with the right medication, diet, and lifestyle choices.